Thank you for joining us, Dr. Guilfoyle. What is the COVID-19 situation in Northern Ontario right now?
In the communities that I work with in the Sioux First Nations Health Authority, we have 31 remote communities, mostly fly-in. And the situation is that we have had very few cases in communities. I believe that we have up to having had 29. We have only one active case at the moment, and we've only had one episode of in-community spread, and we've had no outbreaks in our community. So we've been extremely fortunate.
So Northern Manitoba First Nations have been hit hard with COVID-19 in recent weeks. How have the Northern Ontario communities been able to keep the COVID-19 impact relatively minimal?
We've been, I think, lucky. We also have been able to, when we have had a case, get out ahead of it with contact tracing. The communities have been working extremely hard for months to keep their communities safe with perimeter security and screening at airports and travel entry points. And they also are fairly remote, and so travel, they don't have the same volume of travel maybe as some drive-in communities, so that may be a factor.
So how has the vaccine rollout been going in Northern Ontario?
Really, the vaccine rollout has been going exceptionally well. It obviously is difficult to bring vaccine to remote communities. We have had, in the last week, we've had 5 of our communities have received the vaccine. There were 1,500 people eligible. 875 got the vaccine, which gives us an uptake rate of 60%. We would like it from a public health point of view to be higher, but to be fair and truthful, that is good. We would hope it can get higher in the rest of our communities as more people get used to it. And in fact, there's more acceptance of the vaccine as we see how safe it is, and that at this point we've over 60,000 First Nations have received it, and there's been very little in the way of side effects or problems.
Now, Ontario's state of emergency declaration expires on Tuesday. What do you think should happen once it expires?
Well, our communities have behaved very differently from the rest of Ontario. Our leadership have decided that they would have very strict restrictions on travel and very secure precautions to make sure people entering the communities are screened, are making sure that they're not carrying the virus into their communities and isolating when they come. That is going to continue. The lockdown is really not going to make a big difference to our communities where they live.
Now, I want to go to a couple of questions from our viewers here. One viewer asks, what about people with diabetes? Is the vaccine safe for them?
The vaccine is not alone safe for people with diabetes, but it is highly recommended. If you have diabetes, your immune system doesn't work as well as it should, and you're likely to suffer more than somebody else from COVID. So you will actually get more protection from the vaccine than somebody who, doesn't have diabetes, in as much as you're at much higher risk for really severe disease and dying from COVID. So you will actually get protection if you take the vaccine.
And another viewer is asking, how long will the COVID vaccine be effective once I receive it?
We don't know the answer to that. The data we have, because this is a new vaccine, hardly stretches out to a year. And so therefore we will only know how long the immunity lasts over time. And as we see, hopefully, as more of us get vaccinated, we will hopefully see the viral activity reduce. But it will take time to determine how long this protection lasts.
All right, Dr. Guilfoyle, I want to thank you again for joining us. That is Dr. John Guilfoyle joining us from Squamish, BC.